Hello and welcome back to another episode of Test, Don't Guess Tuesday. I'm Melissa, I'm a functional gut health specialist, and in this series, I review the GI map test of my clients and tell you what we did to get them better. So today, you're in for a treat because this is a really cool case and a really happy ending. I had a 42-year-old client. She was a female. She had a history of chronic constipation for 5 years post C-section. So that was her last child. She had a C-section. She healed beautifully from the surgery, but then developed constipation. She did go back into the doctor about this to make sure that there wasn't some kind of blockage or scar tissue before she came to me, because when that is an issue, it cannot be fixed. It needs surgery, right? It cannot be fixed with supplements or lifestyle modification. So she was clear on that. There was no blockage. Since the end of the summer, right, a couple of months ago, she developed some pretty severe stomach pains. And she noticed that the pains were worse when her stomach was empty and almost like right before she was eating, when she was like gearing up for a meal. Her stomach would be really painful and hard for her to eat. But then she felt that once her stomach started to fill up, the pain went away. She had gained 20 pounds in the last 2 years, so she was able to lose the baby weight after the C-section. And then over the last 2 years, 20 pounds crept up. She has no idea why. She continues to be severely constipated and now with the stomach pain. So she came to see me. She had normal, regular blood work from her doctor, a CBC, right? Complete blood count, looked normal, and really not too many other issues. She was getting a normal period, had some problems around that time of the month, but nothing severe, and really pretty healthy otherwise. So let's dig into her GI map, right? Because when she came, my point was, let's test. We don't need to guess at this. We can get the information we need to make the decisions that will heal us. So that's exactly what we did. So let's dive in. Okay, this is her test. The first page we're going to skip because everything was normal. I usually, when I see people with chronic diarrhea or problems in that area, the first page is full of information, but we're going to skip right here to the H. pylori. So you can see at the very top here that H. pylori is an issue. Her level is high. She's having burning stomach pains. Let's pause and review what H. pylori is. H. pylori is a bacteria that burrows into the lining of your stomach, and it releases an enzyme so that the stomach acid in your stomach is decreased. Having a non-acidic environment allows the H. pylori to grow and prosper. Right? So it's cutting down your stomach acid and will cause burning pain as it burrows into the lining of your stomach. So that's what we're seeing with her. That is what's happened. Over time, undiagnosed H. pylori almost always leads to constipation because without enough stomach acid, remember that bacteria is lowering the amount of stomach acid. Without enough stomach acid, we're not digesting our food. Common to see reflux, but also common to see constipation because as food is making its way out of the stomach into the intestines, not fully digested, everything grinds to a halt. Everything slows down. So when I see H. pylori on a test and symptoms like she was having, I know immediately that's the first thing we address. And we did. And we'll get to that in the treatment part. Here at the bottom, you will see the commensal and keystone bacteria. Remember, these are the bacteria that we know do great things in our guts. And we want all of these levels to be right here in the middle of the green. And you'll notice here that the Escherichia level is slightly low, that Akkermansia and fecal bacterium prausnitzii undetectable. When we see both of those, I know that there's not a lot of butyrate being made in the gut, and that can lead to weight loss resistance. I think that's what we're seeing here with her. The Bacteroidetes and Firmicutes levels are both low. I really think about making some dietary changes when that happens. So the next page of the GI map. And we know now that there's not enough stomach acid. And we know that when that happens, things tend to overgrow. The baddies prosper. So here we see that clearly. The strep is overgrown. And when we look down here to commensal overgrowth microbes in the second section, she is got a little of the methanoBacteria family. That tends to rise as SIBO develops, right? And because food's not fully digesting in the stomach and being forced to digest lower and lower in the intestines, it's not uncommon to see a small intestine bacterial overgrowth. She didn't complain of a ton of bloating, and you can see this number, it's 6.27. This is the line I'm looking at. Hasn't reached, the high level yet, but if things continue, she's headed for SIBO. You'll see Klebsiella here also rising. That's an inflammatory and autoimmune related bacteria that we would definitely want to take down, wanting to make sure that this whole area, this whole inflammatory section is under detectable limits. Same thing down here. This commensal inflammatory and autoimmune related bacteria, this is trouble. This is trouble brewing. She was very grateful that she came in when she did, because we were able to wipe these out. You can see here Candida's creeping up. And so she has overgrowth. That is what's happening. The bad guys are not being held in check here. You know me, you know this is my favorite part of the test, not the parasite part, right? Remember, parasites are hardly ever detected in the poop. They don't live in your poop, right? They live in your tissues. And so when we do parasite testing, we rarely see them. However, the intestinal health markers section is my favorite. Digestion, steatocrit and elastase 1 tell us how well she is digesting, right? So she doesn't have a lot of fat in her stool, great, and her digestive enzymes are doing their job. I would say that my suggestion to her was, as soon as we get rid of the H. pylori, we need to start raising the stomach acid, and we'll do that with some betaine HCl, but not until the H. pylori is gone. Otherwise, you make problems much worse for the patient and client. Beta-glucuronidase is here nice and low. It tells me that her liver is functioning beautifully. Hormones are doing their job. A little bit of blood in her stool. She did have a hemorrhoid, so that is easily explained there. Secretory IgA, 526 is getting low. That's telling me that her immune system that starts in her gut is weakening. We need to beef up the gut. And one of the easiest ways to do that is to get rid of gluten in her diet. Under immune response, you see this little marker, anti-gliadin IgA? Almost everybody who comes to see me says they have no problem with gluten, but this test, it'll tell you. And here we see she's very reactive to gluten. Look how high that number is, 247. She needs to remove gluten from her diet. Her inflammation levels will come down. I would expect that her immune response, we would see a little bit better. Inflammation, again, creeping higher, not so bad yet. And then when we look at the add-on test, which was the zonulin, creeping higher, leaky gut, we really need to take care of her gut lining. And this last section of the test just tells us about H. pylori, and it tells us about the drugs that you can use to treat H. pylori. I don't use drugs. I always use herbs. I find I have much better treatment outcomes without a lot of side effects. However, if someone was going to be treating her H. pylori with medication, amoxicillin is a yes, clarithromycin is a yes, tetracycline is a yes, but those fluoros, she can't. Will not work for her. So that's another bonus of this test. I don't really use this section, but I point it out because you'll see it on your own test. And I remind you that if you are suffering, stop. Figure out what's happening. Take one of these tests. Look at these intestinal health markers and all of the bad bacteria that's overgrowing. You'll have a better sense of what's driving your stomach pain, your bloating, your inflammation. Otherwise, you are just guessing. In the Digestive Discovery portal, digestivediscovery.com, you order your own test. There is lots of information there to help you interpret that test, to understand what's going on. Let's talk real quick about what we did here for this little lady, and we fixed her right up. We used Biocidin. Biocidin makes a lot of great products, and they have a whole microbiome restoration program that includes olive leaf. It includes their proprietary herbal blend that we use to kill these bad guys. It includes a good probiotic, so we make sure that when we are killing the bad guys, we are also beefing up the good guys. And it includes a binder. Remember, anytime that you are killing things in your body, I don't care what you're taking, if you're taking garlic, if you're taking an antibiotic, you should be taking a binder. That will help to sop up the yuck and get it out. Often those are made with activated charcoal or blends of, I believe the biocidin has some zeolite, some aloe, some other clays, I think, and definitely charcoal. And so that's what we did. And we actually stayed on it for 3 months. After about 7 weeks, her stomach pain started to go away. We also worked on a small bowel program. We increased magnesium citrate. I love a product from Cellcore called Bowel Mover. So we worked on that end as we were working on the top end, right? Because we have to work at the top if we want to affect the bottom. So when we talk about the top, we talk about the diet. We talk about the enzymes that are happening in the stomach. Once the H. pylori went down, she went on some betaine, HCl, and digestive enzymes to try to start beefing that up. Again, we slowly tapered down from the bowel program. She got off the bowel mover. She was just on magnesium citrate. As her stomach acid started to rise, everything started to work better. We retested 6 months after starting to work together, and these numbers were beautiful. The H. pylori was completely gone. A couple of numbers, you're always going to have, remember, fluctuation. So a couple of numbers were high. We did a little bit of work on her Akkermansia and her, here you can see on this page, the Akkermansia muciniphila and Faecalibacterium prausnitzii were really low. There are targeted supplements we can use for those. So I hope you learned something. I hope you stay tuned for next week's episode of Test Don't Guess Tuesday. I'm Melissa Hall-Klepacki, your functional gut health specialist. Thanks for tuning in. Stay well and test. Don't guess.